We're live. Okay, so tell us your name.
My name is Corinne Whitlow.
And you are?
Laura Estrella.
And you are both nurses?
Yes.
Right, what kind of a nurse are you?
I'm a cardiac nurse.
And you are
I'm a registered nurse on the telemetry unit that takes care of stroke and oncology patients.
And you were both nurses during the COVID
Yes.
pandemic?
Yes.
Correct.
Right, we're going to start with you. Tell us what you know, what you saw.
So in the beginning, it was a lot of pressure to receive the vaccine. So a lot of my fellow nurses and we did a lot of discussion. We ended up writing a lot of religious exemption letters for each other. And about 50% of my unit did not end up getting the shot. There was a lot of pressure to do so, so you're going to lose your job. But they did not fall for it. And so we did end up with about a 50% acceptance rate, though, just because, and then they regretted it. I talked to a lot of people who had a lot of regret. We ended up going to seek legal counsel as to whether or not we would be dismissed from our jobs, what kind of recourse we would have. And we ended up, most of them went with mask mandates. I fought a lot against the mask mandates and ended up being on enforced LOA, or leave of absence, for 12 weeks because I was allergic to the masks they were requiring me to wear. And they finally found one I could wear, so I came back to work. Mainly after that, it started being patient experience. So it was patients who were coming in with pulmonary embolism, who were with myocarditis, with bacterial endocarditis. We had strokes, we had neurological deficit, all within a week or 2 weeks after receiving their vaccine. And I gave many of them, alternatives on what they could do to seek recourse for the injuries they received. I don't know if they ever pursued it, but it was hard seeing 25-year-olds, 35-year-olds coming in with heart attacks, with strokes, with endocarditis that required valve replacement in their heart because they received the vaccine. So then we also saw ICU patients who were getting remdesivir, who were ending up on ventilators, who ended up on dialysis because of remdesivir. And we did have a meeting with administration about our concerns. A group of nurses we talked to all of our hospital administrators, and we said, look, this is what we see happening. And there really was no change. We were completely ignored.
So what we've been seeing on the bus is the people who got the shot and with the injuries that you described, and then the people who did not get the shot that were put on remdesivir, vented, and went the other way. We're seeing two different, and it's consistent as we travel around.
That's been my experience
almost
as well.
Like the unvaccinated, you're going to go that way.
Yes.
The vaccinated, you're going to go. Did you ever talk to your colleagues about what was going on?
Many times, but then the whole attitude was like, what can we do? We can't change hospital policy. We can't force the hospital to stop using remdesivir and start administering more vitamin C, more zinc, more vitamin D, any of the alternative modalities that we offered to suggest to them. And so I saw a family of 13 who came in with COVID. All of them ended up in the ICU. 10 of them survived, and 3 of them that didn't were the ones that were placed on the ventilators and had remdesivir. And it's difficult because I have coworkers who new parents who are newly pregnant moms who get the shot, and then their babies, I've seen one lose one to miscarriage at 7 months, one was stillborn, one died 9 hours after the birth of the baby because of clotting issues, and they were all vaccinated young moms. It's hard to watch, and it's hard to see the regret on their faces and listen to them say, I wish I'd never gotten that shot.
So for you, it's clear as day that the shot was causing all these injuries.
Right. I was submitting emails almost daily to our director of medicine. This patient came in, had these symptoms, they got their shot this many days ago, this is clearly an attachment, they had no other prior medical history, there was no comorbidity, and so I was submitting emails almost daily with patients who came in with injuries.
So the one thing I'm finding really weird and confusing right now is I'm not getting people talking about, so they authorised the COVID shots for 6 months and above. Where are the injuries of those babies? We know those babies have been injured. And you're not in pediatrics,
no.
So you're not going to see them.
Right.
I need someone to come and tell me what's going on with those babies. We're not hearing anything, it's silence.
Right.
We send a lot of our babies to the Bay Area from the Central Valley here, and unfortunately a lot of our physicians and nurses in the Bay Area complied with a lot of these things, and they're not going to speak up, and I think that's why you don't hear a lot about that. We have a friend who's a nurse in a pediatric department in the Bay Area, and she was one of the only people who refused the COVID shot, and she had to jump through hoops to get her own testing. She had to pay for her own testing. She had to go before work to get her test done, and she was like the only one, and there's a lot of things that get held above her head as well. They know she didn't get it. They know that she's a risk for them, and they target her really badly, and they still are giving her challenges. She's at the point now where every time she refuses a booster, she has to apply for a new exemption.
So one more question before we move on. So you said 50% did not get the shot, 50%
Right.
did.
Right.
So the 50% that didn't get the shot were asked for leave of absence, right?
They weren't asked to leave their positions.
weren't?
No, we all got exemptions for them.
Okay.
Yeah, exemptions were all granted at my facility. I know there were other facilities in town that ended up firing their nurses who didn't get it, but for ours, we were able to keep all our jobs.
Because what we're hearing from the remdesivir deaths and hospital protocol killing, that the ones that were fired were replaced with really ghastly, evil meanies, not the people that were there before. And so we're trying to get to the bottom of that. Who are these people that came in and replaced the unvaccinated nurses? And where did they come from, and why were they the ones that were reporting to
I know the one facility in our local area that did fire people for not getting the vaccine, they hired travelers that were unvaccinated, ironically. And oftentimes travelers just come, they get paid really high prices, and they do whatever they're told to do.
Right, there you go. So it's all about money. You pay me this amount of money and I'll...
And they're there for a
Definitely.
very short period of time, so they do their job, they get their money, and they move on to the next thing.
I think they were making up to 3 times more than the regular salary rate here. So they get paid 3 times as much as we were paid to be unvaccinated and work the same position as the unvaccinated person that was fired left. It made no
to do as
sense.
they were told.
Yes.
All right, let's hear your story, please.
Okay, yeah. I'm a mother and a nurse. Actually, COVID shutting down everything and affecting my children is really what got me engaged, from taking it from just my personal level to a local level. And then when I was working at the hospital, things that I had been doing for the last 7 years suddenly changed for a different respiratory virus that I had never heard of before. So immediately I was just confused why suddenly we weren't following common protocol, common sense, and doing things that we had always done as nurses. So that initially was my reaction to what was going on. So I started asking questions just like I do in my normal life. But I wasn't getting answers like I normally do. So I just kept working my chain of command at the hospital. And as Laura kind of spoke to, it was just people doing as they were told. And we continued to work our chain of command, and that's kind of where we started to meet a lot of each other. Is as we worked our chain of command, we had common people that we were trying to meet with to find out what was going on. I as well got an exemption for the vaccine and was very lucky to be involved with my administration from the very, very beginning. Actually, before it was even required here in California, I was asking my supervisor, what are they gonna do to protect me in the case that this becomes a requirement and I'm going to flat out refuse? And they kind of laughed about it actually at first and told me I was crazy and that I just needed to not worry about that. And it was less than 2 weeks later that I was actually faced with a situation where it was coming down the pipes. And so I was really involved with administration from the very beginning of what that was going to look like for us. I was very involved with my colleagues, which were very scared. Everybody was very scared what was going to happen. We all thought we were just going to be fired. When we realized that the local hospitals were just going to follow the policies and protocols that were in place, we started going to the county, where we were asking our board of supervisors what our resources are at this point and what the county can help us do in this situation. And we're very lucky to live in an amazing county with some great county supervisors who actually got us in contact with all of our state assembly members and senators, and we held a Zoom meeting with them. And they listened to our concerns, although they weren't willing to make any moves to do anything about it, because again, most of them were following orders as well. So we just continued to engage with our local officials and with our colleagues at our hospitals, and then we started connecting with colleagues at other hospitals, and before we knew it, there were hundreds of us at a board of supervisors meeting, asking questions, basically protesting the fact that as healthcare workers we were going to be forced to do something that wasn't medically necessary or evidence-based at this point, and not a long-term solution. So it just didn't make sense for a lot of us. So after we met with our board of supervisors and we filled up those chambers, and there was hundreds and hundreds of us, I think we really got the community understanding that there's something else going on here, that all these nurses who we have always depended on to take care of us, and I mean, if you're a nurse, you always have someone who's calling you to ask you advice on something. And now suddenly they're looking at us like, what is going on if these nurses are asking questions that don't have answers? So we really just kept with it, and we started trying to get a meeting with our public health officer, which was way more of a challenge than it should ever be to meet with your public health officer. Luckily, we had our Board of Supervisors on our side, and our public health officer is hired by our Board of Supervisors. So they were really persistent with us, and we ended up meeting with our public health officer. We presented some of the information that Laura spoke about. We created flyers and a pamphlet of alternatives to medications when you have respiratory viruses, and just any respiratory virus, because that's kind of what we're dealing with here when we're talking about COVID as well. But we created a pamphlet that had different natural supplements and remedies and treatments to take care of yourself, and getting outside and getting some sunlight and checking your temperature. And we presented that to our public health officer, who basically told us it looked like we were trying to sell supplements. They were not interested in what we had to offer, although our Board of Supervisors were very interested. And our Board of Supervisors were even willing to go to the point of creating like supplement packets for our community. But our public health officer and system just would not allow it. They wanted nothing to do with alternative options. And so we just kept at it. Luckily, that public health officer is not our public health officer anymore. We do have a new one, and we've continued to meet with our public health officers to hopefully prevent things like this in the future. But I would say the things that were really, really hard for us to battle were the policies in place. Because every time we went to somebody about some of our concerns and frustrations, and regardless of what kind of evidence we had, they were just going to follow orders. So once we realized that, I think we started to decide that we're going to take a look at what orders we're following, and we're going to try to battle those. So we had local health emergencies in place. Every county did in the state of California. We were worried about vaccine passports coming to our area. So one of the first things we did is we worked with our Board of Supervisors, and they created a resolution which made it so county services wouldn't be limited by vaccine status. So that was one of the first things. Although it wasn't exactly how we wanted that resolution to go down, it was a great starting point for us, because nothing like that had really been going on. And then next, what we started working at is really battling our local health emergency. And so we just kept asking questions. We were asking for measurable goals. We were asking for evidence-based data. And once we started asking those questions, the Board of Supervisors wanted to know the answers to those questions as well. And they quickly realized that public health had none of those answers, and they couldn't get those answers. So it wasn't very long that it took us asking those questions over and over. And then the Board of Supervisors actually made a move to terminate the proclamation of a local emergency here in Stanislaus, which means nothing, to be quite honest. It was just kind of a document. What we really needed to do was get rid of the local emergency. So we got rid of the proclamation in February of 2022, and we just kept at it. We were respectful but very, very persistent. And by the next month, March 2022, we were actually able to terminate the local emergency here in Stanislaus County, which wasn't done in any other county at that time in California. So we were really, really proud of that. And although it didn't make a bunch of changes to the hospitals that we were working at and stuff, it was giving us a little bit of credit in the community. So when we started taking it to the next level and engaging with our state legislators, we had the backing of our local officials. And so they were helping us build resources. We started to engage with state elected officials, and then we started to see that some of these policies that were at a local level were trying to be implemented by our state legislators. And so there was one SB 871, which would have required the COVID vaccine for children to go to school. That was being presented by Senator Pan. And so although he wasn't available to us at a state level, we came back to work at a local level where we know we can get most of our work done. We worked with our Board of Supervisors. We worked with our community. Our Board of Supervisors actually wrote an opposition letter to SB 871. They wrote a letter to Senator Pan, and that bill never moved forward through the legislative process. And so I'm convinced that those types of things didn't move forward because of all the pressure that was going on in the individual communities that was coming to a head at the state level. Because just in my experience, what's going on at the state is too big and dirty for us to handle. So dealing with it really at the state level is where we do most of our work. And that year we also defeated Senator Wiener Bill's SB 866 as well. So, which would have allowed 12-year-olds to consent to any vaccine at any time without parental knowledge or consent. And that bill we fought till the very last day, and he pulled it. And I have no doubt that it was because of what we were all experiencing here at a local level, not just here at a local level, but what everybody was experiencing in California at a local level. And they started to ask questions like we did. And then those questions turned into basically requiring answers. And then that pressure went from a local level and went to a state level. And then through the work of so many people throughout California, we were able to really defeat some terrible bills that were trying to come out because of COVID. And if they would have came out, if these bills would have passed because of the COVID excuse, they would have just continued to destroy our state and our ability to have informed consent, and specifically really for our children.
Wow.
Yes.
So what do you think is going to happen next, both of you? Disease X is coming, whatever that is. They're trying to create more.
Well, they're always going to try and create
Yeah.
more. I mean, even though the CDC has come out and said we're going to treat COVID like any other respiratory virus now, which we knew all along, they're still going to try to continue to vaccinate for it. But I'm happy to see that most people have woken up and realized that they never needed that first shot. They never needed those boosters, and they don't need to continue to destroy their health. I speak to patients all the time who ask me, should I get the next booster? And I'm like, well, are you sick? Have you been sick? Do you have a problem? Then you don't need a booster. Even if you're old and you're immune compromised, you're better off without it. So I advocate on an individual basis all the time.
Would either of you ever take any kind of vaccination ever again?
No.
No. As a nurse, the CDC was the gold standard. Fortunately for me, it was a couple years before COVID when I had a situation where I actually ended up on the phone with the CDC, and the answers that they were giving me made zero sense for even the common sense brain. And so I started to question things before that point. But I would not take a vaccine at this point. Healthy people don't make the healthcare system money.
True.
So I think they are going to do everything in their power to keep people unhealthy. And so anything that is offered to keep you healthy, I would be concerned about at this point.
So neither of you got the COVID shot, but did either of you get COVID?
I had it once.
Yeah, I got COVID about a year and a half after COVID started. I mean, maybe even before that, but I wasn't sick enough to do anything.
How did you treat it?
I took a nap,
Yeah.
took some Tylenol,
Took some Tylenol, took
drank
some
a bunch
vitamin
of
C,
water,
vitamin C, vitamin
spent
D,
some
zinc.
time outside.
All right. And do you have blood clots or heart issues or paralysis or tremors
No.
or strokes?
No.
Thank you.
Yeah.
Anything else you both want to say?
I do want to add one thing.
Yeah,
When
please.
I was at the hospital and everyone around me was getting boosted, I contacted our HR department and I said, shedding is a real thing. I have the Pfizer vax that shows me that shedding is a thing. They knew it was coming, and I can show you this Pfizer document. So what happens if I'm exposed to someone who just got the booster and I end up with symptoms, side effects from the vax or from COVID, because their side effects are the same thing from COVID and the vax. And they said, well, if that happens, you'll need to file a workers' comp claim. And that tells me that they knew it was a possibility, and they knew that I could be injured by being around all these people that were being boosted. So they were aware. They've been aware the whole time.
I think more to come on the shedding. It's starting to come out now. Everybody knows it's real. And there'll be much more unraveled.
I think so too.
Yeah.
Yeah.
You two are amazing, brilliant nurses, and thank you for being amazing. We need good nurses.
Thank you.